1, 2,
3,
4,
5.
Have you ever wondered what goes on behind the curtain of you or your loved one's C-section? How many people does it take to perform a C-section? A C-section is the surgical removal of a baby from the uterus whenever a vaginal delivery is not an option. It takes a minimum of 6 people to perform a C-section. This includes the anesthetist, the doctor, the first assist, the scrub nurse, the circulator nurse, and the nursery nurse. I'm a registered nurse and I am trained to scrub C-sections. My role allows me to set up the operating room and assist during the surgery. In this demonstration, I will show you how to set up the operating room, perform sterile technique, and pass instruments. Before you can do anything, you must first perform the critical OR checks. The first check is to look at the temperature and humidity monitor to make sure that it's in range. These have to stay in range to maintain the sterility of the environment and the equipment. The second check is the infant warmer. We need to make sure that all the resuscitation equipment is available for delivery. If all these are correct, then you can proceed. Next, you will grab a C-section kit and an instrument kit. This is my C-section kit, and this is my instrument kit. First, I will open them sterilely. To open them sterilely, you must open them away from you. And when you open them away from you, you can only touch the imaginary 1-inch border on the inside of the sterile covering. I'll open the instruments in the same manner. When I open my instruments, I open them and form a pocket around my hand so that way I can place the instruments on the C-section table without contaminating them. Now that I have all my equipment, I'll now don sterile gloves. Sterile gloves will come in this packaging. You will open it facing you, stick your fingers inside the slits, and open them, pulling them taut. Sterile gloves are packaged with the inside of the sterile glove flipped up because this will be touching your clean, non-sterile hands. This allows you to put them on without breaking sterile technique. So I pick up the gloves by the cuff and I insert my hand without touching the sterile part of the glove. Then I will take my 4 fingers and insert them to the inside, the sterile part of the glove because this hand is sterile. I'll also insert this hand. Now that I've donned sterile gloves, I am ready to organize the equipment. This is the finished product of the C-section table. Here I have a bladder blade in the Richardsons used to protect the bladder and to hold back the skin, blades used to cut the skin, hemostats and Kellys used to stop bleeding vessels, straight Oshner's and sponge sticks used to hold back tissue, scissors used to cut tissue and to cut sutures, and then pickups used to help with the suturing and to hold back smaller pieces of skin. When you're passing instruments to the surgeon, you will pick up the instrument by the screw point. The screw point is where, whenever you open the instrument, it is maintained in the center by a screw. So the part that's open, the center point is the screw point. You'll hold it by the screw point with your first 2 fingers and your thumb, and you will smack it into the physician's hand. You do this because the physician will not take their eyes off of their surgical field, and to let them know that the instrument is in their hand and ready for them, you want to smack it into their hand. You'll also hand it to them in the way that they will use it. So since the doctor would hold by the circular parts here at the bottom, you're going to place them in their hand that way. When you hand the physician a blade, you will take the blade, unsheath the safe covering off of it, announce that you have the blade, hold it by the screw point or wherever it would separate from the knife handle, and then you'll place it into their hand like so, keeping your hand away from the point of the blade and then above the physician's hand. This concludes my demonstration on how to set up the OR, practice sterile technique, and to pass instruments. All in all, the scrub nurse performs an important role during the C-section. To be an effective team member, the scrub nurse must practice their role often. This includes performing critical OR checks, practicing sterile technique, and passing instruments sterilely. The entire surgical team should work together to provide safe outcomes for all the patients involved. And this concludes my speech.
1, 2,
3,
4,
5,